The third human case of H5N1 was reported on Thursday in a Michigan farm worker exhibiting respiratory symptoms, highlighting that the current bird flu situation is at a perilous turning point. The virus is evolving in expected ways that heighten its threat to humans, underscoring our failure to contain it early. The solutions to this emerging crisis, such as widespread testing, have always been clear and are becoming increasingly critical. Ignoring the warning signs will leave us with no one to blame but ourselves. H5N1 has been more than just an avian issue for some time now. The virus has spread to dairy cattle across 9 states, impacting 69 herds that we know of. All 3 human H5N1 cases identified so far involve farm workers who were in direct contact with infected cows or milk. The first 2 cases were relatively mild, presenting symptoms like eye irritation or conjunctivitis. However, the latest case has shown more worrying signs, including coughing. The appearance of respiratory symptoms is alarming because it suggests a potential change in how the virus affects humans. Coughing can spread viruses more easily than eye irritation. New symptoms should be anticipated as the virus continues to evolve and adapt to humans. Yet our response to this looming threat has been grossly inadequate, particularly in the realm of testing. Testing is our primary defense in detecting and managing infectious diseases. It enables health responders to gauge the scope of an outbreak, identify infected individuals, and take measures to prevent further spread. Human testing is essential not only for diagnosing current infections, but also for understanding how the virus is propagating. Serology testing, which detects antibodies in the blood, can help determine how many people have been infected with the virus, even if they did not show symptoms. Despite its critical importance and repeated calls for its implementation, serology testing for H5N1 has been virtually non-existent in this outbreak. Without serology testing by state or local health officials, we are likely missing many cases, especially among asymptomatic individuals or those with mild symptoms. This underreporting skews our understanding of the virus's spread and hinders our ability to respond effectively. Undetected cases of H5N1 mean that infected individuals may unknowingly continue to spread the virus. This is particularly dangerous in farming communities where close contact with animals and other workers is common. Each missed case is a potential link in a chain of transmission that could lead to a broader outbreak. Moreover, failing to detect cases undermines the ability to implement targeted public health interventions. If we don't fully grasp the outbreak's extent, we can't effectively allocate resources such as vaccines and antiviral treatments to those who need them most. There's also a human cost. Farm workers, often laboring long hours near infected animals, bear the brunt of this oversight. They are at higher risk for infection, and many lack health insurance and paid sick leave, making it difficult for them to seek testing and treatment. They may also be hesitant to report symptoms or seek medical care out of fear of losing their jobs or facing immigration-related repercussions. As a result, many may continue working while infected, further spreading the virus. This is why we need a comprehensive national testing strategy coordinated by the Centers for Disease Control and Prevention that includes both diagnostic and serology testing. This should be paired with outreach efforts from state and local health departments to ensure farm workers have access to testing and feel safe using it. This means providing clear information in multiple languages, ensuring testing is free and accessible, and offering support for those who test positive, such as paid sick leave and medical care. Health workers should be trained and equipped with tests that can provide a rapid diagnosis, prompting timely and appropriate treatment. The United States must also enhance surveillance and data collection to gain a clearer picture of the outbreak. This includes increasing testing in areas with known infections, conducting regular screenings of at-risk populations by state and local health departments, and using innovative methods such as wastewater surveillance to detect the virus in communities early. Complicating our understanding of the outbreak, the U.S. Department of Agriculture has been slow to share crucial virus sequence data from animals infected with H5N1. While several states are continually reporting new infections in cows, the USDA has not shared a virus sequence collected from a cow in several weeks. This H5N1 outbreak serves as a warning. The report of respiratory symptoms is troubling, and this is not an effective way to prevent a pandemic.